it's nice seeing you again. Okay, so last time we met, we kind of went through our examination, and you were diagnosed with muscle tension dysphonia, correct? Okay, awesome. So let's go ahead, and today I want to kind of run through with you just some basic information of what muscle tension dysphonia is and kind of what treatment will look like, and just a rundown in general. And so I have this handout right here, and I will give you a copy, and we'll just kind of run through all of this information today and see what questions you have. So basically, muscle tension dysphonia, and I'll also refer to it as MTD, basically it is just discomfort when you're talking, and it is a change in your voice. So like when you came in, you said that your voice was very rough and gravelly sounding, and that wasn't normal for you. And it's caused typically by tightness in the muscles around your larynx, or also known as your voice box. And it is the most common cause of hoarseness, and it affects people in a variety of ways. There are two types of MTD. The first one is primary, and that's just basically the muscles in your neck are tight with no abnormalities found in the larynx. And then secondary is the other type, and that is when there is an abnormality found in the larynx, and that can cause a person to overuse their voice or their muscles when trying to use their voice. Thankfully for you, you have primary MTD, which is great. There was no abnormalities found on your larynx or voice box when we did our examination last time, so that's good. And then the prevalent rate is individuals in their 40s to 50s, so that is within your age, and it is also common in women, more so than males. Some common symptoms and signs that you can see with muscle tension dysphonia is vocal fatigue. You can have, your voice can be kind of unreliable. It can sound low and gravelly, airy and breathy, hoarse and rough. You can experience voice breaks or have trouble and need extra force to speak in a loud voice. Symptoms can worsen under stress, and sometimes even your voice returns back to normal. There isn't really any known causes specifically for MTD. However, we do know that things like irritants can contribute to it. So things such as a respiratory infection, if you smoke, you can contribute to it. Acid reflux, or if you have a very demanding job and you place excessive demand on your voice, that can also contribute. And sometimes one of these factors contributes to it, sometimes all of them do. It really just depends on the individual. And then how is it diagnosed? Well, you are kind of familiar with that since we went over that last time we met, but basically like we did with you, it's an examination of your voice and your vocal folds with a camera, and that's either done by an SLP or a voice specialist. And then we also just make sure that we exclude any other possible concerns or reasoning for your symptoms. So that means just looking at your full medical history, the examination, and making sure we rule out any other possible reasons. And then finally, for treatment, which is what we're mainly here to talk about today, is voice therapy. That is the most common form of treatment for MTD, and it has a very high success rate. And it really just means that we'll work on vocal techniques and voice techniques to strengthen and rebalance the laryngeal and pharyngeal muscles. We'll learn how to produce a healthy voice to prevent overuse and abuse of your voice. We'll also look at learning suppression and breathing strategies to minimize coughing and throat clearing, which can contribute to irritation. And then It's also possible, it's not as common, but Botox can be used alongside voice therapy to help with spasms in the larynx or your voice box if that is necessary. But yeah, it is pretty straightforward, and I don't think we will have any problems getting treatment started. But if you have any questions ever, please feel free to reach out to me, and I will be available to open them or answer them. Sorry. So yeah, is there any questions you have at the moment? No? Okay, great. But yeah, feel free to reach out to me, and we will get you scheduled for your first appointment. All right, thank you.